Good morning, I'm Dr. Julene Samuels and I'm a plastic surgeon. We're here in my offices at Norton Commons and want to welcome you to this morning's segment on Great Day Live, our Monday Makeover segment. And today I thought we would spend a couple minutes talking about pain control with plastic surgery. And this is something that I think patients struggle with this. I have spent many hours talking to patients trying to figure out what is a motivating factor for them when they choose a plastic surgery procedure. But then we also want to talk about or ferret out some of the things that could be obstacles to their decision to have plastic surgery, and not even surgery. Sometimes it's some of the non-surgical procedures that we're doing, whether it's a laser or a microneedling procedure. We want to make patients comfortable, but we want to reassure them at the very outset that they will be comfortable. So we'll start talking a little bit about some of the new things in plastic surgery. We have a device called Pronox. This is especially useful when patients are having procedure that are not being done under any type of anesthesia, not IV sedation and not general anesthesia. So we will use an oral cocktail of medications, and then we have usually a bit of a numbing procedure that is being done, an injectable numbing, and we will let patients use the Pronox. This is a gas that is mixed with oxygen that we breathe. The patient administers the nitrous oxide with the oxygen themselves, and so therefore never gets over-sedated. So Pronox is very popular for Profound, one of the microneedling technologies that we have, for Exceed, another microneedling technology, for laser resurfacing, or sometimes just if somebody's nervous about having Botox or a filler. The second new thing to have come along that's really changed the landscape of even some of our surgical recoveries is this product here called Desuvia. This is actually a lozenge that we can administer to the awake or the asleep patient so that we can provide additional pain control that lasts 3 hours. The patient never receives enough medication for them to go to sleep or be disoriented or dissociated. They just have no pain for 3 or 3.5 hours. And this is a very simple lozenge under the tongue. This is a sufentanil lozenge. So sufentanil is one of the products that we can give IV during anesthesia. If we want to use this right as the patient is about to wake up from an anesthetic, administered anesthetic, we can give them this 30 minutes prior to the end of the procedure. Their recovery is smoother and their transit home is usually much more comfortable as well. During our tummy tucks, we have actually an inserted pain pump that we will use. So when I've done the tummy tuck and I've got the skin closed and the muscles tightened, one of the things we tell our patients preoperatively is that any associated liposuction of a tummy tuck, typically the flanks or the waist, is not really what is going to be considered uncomfortable. What's uncomfortable during a tummy tuck is the plication of the muscles of your sit-up muscles that are expanded and stretched and weakened with weight gain, pregnancy, and just aging. So during a tummy tuck, I will insert a pain pump that is taped into place, and it provides anesthesia for 4 days. During a tummy tuck patient's recovery, that first 4 days is much more comfortable now and has really sort of changed the landscape of our tummy tuck recoveries. So thanks for joining us today, talking about control of pain with some of our procedures, and nothing to be afraid of. We hope to meet you soon, and thanks for joining us this morning, and we'll see you again next week.